I'm Elizabeth McKay. I'm a nurse navigator with Connect Care 3. Joining me today is my colleague Jean Good, and we will be presenting Cancer 101, Know the Facts, Reduce Your Risk. Good morning, Jean.
Good morning, Liz. Happy to be here and talk about cancer, and hopefully some people will take something away from this and learn something new today.
Good. Okay. Well, I'm going to begin with the facts about cancer. So cancer is the second leading cause of death in the United States. In 2020, it is estimated that 1.8 million new cases of cancer will be diagnosed, and over 606,000 people will die from the disease. The lifetime risk of developing cancer is approximately 39.5% of men and women will be diagnosed at some point during their lifetime. Cancer is most frequently diagnosed among people ages 65 to 74, and the median age of diagnosis is 66. The percent of cancer deaths is highest among people ages 65 to 74, and the median age of death is 72. Each year, the United States spends about $147.3 billion since 2017. So in future years, this is estimated to increase as the population ages and cancer prevalence increases. This is due to often more expensive treatments that become adopted as standards of care as well. So the good news is that in the US, from 1991 through 2015, the overall death rate for cancer fell by 26%. And the 5-year relative survival rate from 2010 through 2016 was 67.4%. In 2017, there were an estimated 15.7 million people living with cancer in the United States. So cancer is becoming a chronic health condition. So what is cancer? The National Cancer Institute describes cancer as a collection of more than 100 related diseases. In all types of cancer, some of the body's cells begin to divide without stopping and spread into surrounding tissues. A cancer can begin almost anywhere in the human body, as each body contains trillions of cells. And all cancers share the characteristics of abnormal cells growing and at uncontrolled rates that continue to divide and traffic into surrounding tissue. This is also called metastasis. Types of cancers are usually named for the organs or tissue where they originate from. For example, lung cancer that metastasizes to the brain or to the lung, or to the liver is still called lung cancer. Cancer can also be described by the type of cell that form them, such as epithelial cells or squamous cells. Our next chart here shows an example of how cellular division occurs in a normal cell. On the first line, the cell divides properly and it remains well differentiated or looking like the cell it originated from, and it has uniform cell growth. In the bottom line here, it shows how a cancer cell divides. So basically, when a cancer cell divides, or when a cancer becomes damaged or something goes wrong with it, our body has a mechanism of programmed cell death inside of our cellular structure. For whatever reason, the cancer cell does not die or undergo apoptosis, which is cellular death, and it continues to divide in an uncontrolled fashion and in an uncontrolled way and multiplies, and it forms a tumor. And one distinct thing about cancer cells, unlike normal cells, is that they can traffic into other areas, which is called metastasis. They can also set up their own blood supply. And so that's a kind of a good visual of showing the difference between the two. So what are the most common types of cancer? I've ordered these in order of occurrence in the United States according to the American Cancer Society. So in order of occurrence is breast, lung and bronchus, prostate, colorectal, melanoma of the skin, bladder, non-Hodgkin lymphoma, kidney and renal pelvis, uterine, and leukemia.
So Liz, can you tell us a little bit more about what causes cancer?
Jean, that's an excellent question. So cancer is a very complex group of diseases with many possible causes. Only 5% of cancers are hereditary, which means many cancers may be preventable. Risk factors include age, genetics, obesity, tobacco use. There is no safe form of tobacco, excessive alcohol use, sun and other types of radiation, and viruses such as HPV, which is human papillomavirus, EBV, which is Epstein-Barr virus, HIV, HBV, which is hepatitis B, and HCV, which is hepatitis C, which both can cause liver cancer. So worldwide, infections are linked to about 15 to 20% of cancers. The human papillomavirus has a role in causing cancers of the cervix, penis, anus, vagina, vulva, mouth, and throat. Almost all cervical cancers are caused by an HPV infection. Most people will never know they have HPV because the body can usually fight the infection before symptoms occur. But high-risk types of HPV, such as strains 16 and 18, can cause serious precancers and cancers of the cervix. Epstein-Barr virus infection increases a person's risk of getting nasopharyngeal cancer, which is cancer in the back of the throat and nose, and certain types of fast-growing lymphomas, such as Burkitt lymphoma. It may be also linked to Hodgkin lymphoma and some types of stomach cancer. Overall, very few people who have been infected with Epstein-Barr virus will ever develop these cancers. Also, there are currently on the market vaccines for the human papillomavirus, as well as the hepatitis B virus, and there are treatments for hepatitis C virus. So how do we reduce our risk of developing cancer? There's many things that we can do. First of all, maintaining a healthy weight, being active, not using tobacco in any form, drinking alcohol in moderation, and just to clarify moderation, that is no more than 2 drinks per day for men and 1 drink per day for women. A drink of alcohol is defined as 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of 80 proof distilled spirits. Being safe in the sun, getting screened, and talking to your doctor about your risk factors. So increased body weight can be attributed to many different types of cancer, and that includes breast cancer in postmenopausal women, endometrial cancer, colon and rectal cancer, esophageal cancer, pancreatic cancer, liver and kidney, as well as several others. So this is a shocking statistic. Body weight and cancer risk. 71% of American adults are overweight or obese, according to the American Cancer Society. So that's 3 out of 4 adults. Physical inactivity, excess alcohol consumption, poor nutrition, and excess body weight can all increase your risk factor and basically can be attributed to about 1 in 5 cases of cancer. And obesity raises a person's risk of getting the 13 types of cancer that I already talked about. So how do we determine if we are overweight? There are many different calculators online. You can just Google BMI and you can get an online calculator, or you can do it yourself. You take your weight in pounds, multiply by 703, divided by your height in inches, and that will tell you your BMI. So if you have a normal BMI, that number will be between 18.5 and 24.9. Overweight is a BMI of 25 to 29.9, and obese is a BMI above 30. So if you are overweight or obese, you can take action and decrease your caloric intake by 500 calories per day, which will equate to a weight loss of about 1 pound per week. And you can also increase your physical activity to even lose more weight. So, as in anything, there are disparities in cancer. Disparities are often seen in populations with lower socioeconomic status, those who live in areas with limited healthcare access, those with disabilities, ethnicity that predisposes them to genetic factors, and gender identity issues. Risk factors that can be attributed are genetic and biological factors, healthcare access, socioeconomic factors, chemical and physical exposures, which can also be occupational related, poor diet, and physical inactivity.
So Liz, can you tell everybody how cancer disparities are being addressed in today's healthcare world?
Yes, Jean. So thankfully, these disparities are being addressed. They are researching factors that may influence cancer risk. As we just discussed, there are clinical trials that test in diverse populations. Programs are being developed that address cancer cases in diverse and rural communities, and training medical personnel to increase diversity in the cancer research workforce. So next, I'm going to turn it over to Jean, and she's going to talk about cancer screening.
Thank you, Liz. So cancer screening increases the chances of detecting certain cancers early when they might be easier to treat. Through early detection by screening, death rates have been reduced in cancers of the breast, uterine, cervix, colon, rectum, prostate, and lung. Consult your primary care physician to discuss the screening intervals and tests that are appropriate for you. You're going to hear me say that many times throughout this presentation because it really is important. It should be following screenings, but following screenings that are appropriate for you. At the Commission on Cancer's virtual annual meeting this year, they determined that screenings are down significantly across the country due to COVID compared to the same time last year. They were able to estimate that mammogram screenings were down 87%, colonoscopies were down 90%, and pap smears were down 83%. It is important to know that almost 47% of people learn they have a new diagnosis of cancer through a cancer screening test, according to the Commission on Cancer. It is important to have screenings needed based on your personal risks, health history, and family history. And we'll talk more later about how to have safer screenings during the COVID-19 pandemic. We're going to talk about breast cancer screening. Mammograms have been a game changer in breast cancer outcomes because they can detect cancers that are too small for you or your physician to detect during a breast exam. Women between the ages of 40 to 44 should have the choice to start annual breast cancer screening with mammograms, which is a type of X-ray, if they wish to do so. Women ages 45 to 54 should have mammograms every year, and women 55 and older may switch to mammograms every 2 years or may continue yearly screenings. Screenings should continue as long as a woman is in good health and her life expectancy is 10 years or longer. Monthly self-exams are also an important part of screenings, including for those younger women who are not part of the age to have mammograms. The Mayo Clinic website has information on how to perform a self-exam for those who would like that information. And we've also included that on our resource page at the end of our presentation. Your physician could also teach you the same. Screenings for cervical, ovarian, and endometrial cancer. You heard Liz say that most cervical cancers are related to the HPV virus, and there is a vaccine, and depending on age, you might be eligible for that. Also, endometrial cancer is associated with obesity. So while I was preparing for this webinar, the screening guidelines for cervical cancer screening changed. The new guidelines released by the American Cancer Society were updated to recommend screening begin at the age of 25. The new guidelines also recommend that women ages 25 to 65 have primary HPV testing done every 5 years, and this is the virus Liz spoke about. Women over the age of 65 might be able to stop this screening based on their history of results and other factors. There are currently no screening recommendations for ovarian cancer. Symptoms of ovarian cancer can be subtle and hard to recognize, which is one of the reasons when it's typically diagnosed, it is later in the stages of the disease. Some of the symptoms of ovarian cancer can include bloating or an increase in abdominal size, pelvic or abdominal pain, difficulty eating or feeling full quickly, and urinary symptoms. This does not mean that you have ovarian cancer if you have these symptoms, but it's a good idea to have them checked out to determine the cause. The American Cancer Society recommends that at the time of menopause, all women should be told about the risk and symptoms of endometrial cancer. Any vaginal bleeding after menopause is not normal and is a reason to see your healthcare provider to determine the cause. Women should report any unexpected vaginal bleeding or spotting to their doctors. Once again, this does not mean you have endometrial cancer, but it's important to have the symptom checked out as soon as possible and not months down the road. So once again, you can see how important it is to talk to your physician about what's right for you based on your personal health history, prior results, ages, and changes in guidelines. If you are at average risk for developing colon cancer, most experts recommend having a colonoscopy every 10 years. The American Cancer Society recommends that colon cancer screenings begin at the age of 45 in both men and women. This is 45. You may be familiar with 50, but it did change just a few years ago. So the age to start colon cancer screenings is 45 in the United States. According to the American Cancer Society, you might be a candidate for a stool-based screen. However, this is a conversation, once again, you'll need to have with your primary care physician. They'll be able to make a recommendation based on your personal risk. If you have other risk factors, such as a family history or certain genetic disorders, your physician may recommend you start younger than the age of 45. Typically, cancer screenings for colon cancer continue through the age of 75. If polyps are found during your colonoscopy, your follow-up recommendations will be different than someone who had no polyps show up, and it might be more shorter intervals, more like every 3 to 5 years. Screening for prostate and testicular cancer. Currently, the American Cancer Society does not recommend routine testing for prostate screening for all men at this time because they believe proper pre-test guidance and education is necessary. So starting at the age of 50, men should talk to a healthcare provider about the pros and cons of testing so they can decide if testing is the right choice for them. So once again, this is why it's so important to have a yearly exam with your primary care physician. There are currently no recommendations for testicular cancer screening. In some men, early testicular cancers cause symptoms that lead them to seek medical attention. And it could be a swollen testicle or a lump that they're feeling. Self-exam is recommended for men, and the way to perform a self-exam is listed on the American Cancer Society website. But once again, we included that on our resource page at the end of this presentation. Lung cancer screening. Currently, the American Cancer Society does not recommend tests to check for lung cancer in people who are of average risk. However, they do have screening guidelines for those who are at high risk of lung cancer due to cigarette smoking. Screening might be right for you if you have all of the following. You are 55 to 74 years of age, you're in good health, and you have at least a 30-pack year smoking history and are either still smoking or have quit within the last 15 years. So a pack year is the number of packs smoked each day multiplied by the number of years a person has smoked. So someone who smoked a pack of cigarettes per day for 30 years has a 30-pack year smoking history, as does someone who smoked 2 packs a day for 15 years. Screening is done with an annual low-dose CT scan of the chest that's ordered by your primary care physician. So we'll talk about skin cancer. And skin cancer is the one cancer you can see, unlike most others that develop inside the body. Concerning signs that you might have skin cancer include a growth that increases in size, appears pearly, transparent, tan, brown, black, or multicolored, a mole, birthmark, or brown spot that increases in size, thickness, changes color or texture, or is bigger than a pencil eraser. A spot or sore that continues to itch, hurt, crust, scab, or bleed, or an open sore that does not heal within 3 weeks. If you see something new, changing, or unusual, call your physician to get it checked out. Some areas of the country experience long wait times to see a dermatologist. If you call and that is your experience as well, see your family physician. She or he can also check out the area of concern and expedite an appointment with the dermatologist when needed. It's also important for you to learn the ABCDEs of melanoma, and that is A for asymmetry, B for border, C for color, D for diameter or darkness, and E for evolving. Not all skin cancers are melanoma, but you heard Liz list melanoma as one of the more common cancers in the United States. So, universal guidelines for screening. As you've heard me say multiple times today, it's really important for you to consult your primary care physician about specific screenings that are appropriate for you, including the timing of beginning, continuing, and ending screenings. Screenings are based on age, health history, family history, your sex, and other factors you might have. If screening guidelines are being followed by your screening facilities, they are typically covered at 100% and the deductible does not apply. The national guidelines are periodically reviewed and modified with information gathered from studies about a particular cancer and what may help to diagnose that cancer at an earlier stage. Don't delay these 3 screenings. The University of Pennsylvania experts have identified these 3 screenings as very important screenings to have even during the current COVID-19 pandemic. However, your health history and individual risk factors should be part of the decision-making process regarding timing and types of screenings. This includes the question, are you a member of the vulnerable population as identified by the Centers for Disease Control? Talk to your doctor and make a plan for what makes most sense for you based on your personal risk and your personal safety. Screening during COVID. According to Dr. Mitra Kochar at University of Pennsylvania, the idea behind cancer screenings is to find things before they become a problem and when it is easier to do something about them. Cancer won't wait for the end of the pandemic, nor, she says, should screenings. The later cancer is detected, the more complicated the treatment plan begins. Another way of saying this is with the finding of an advanced cancer, this would typically mean more aggressive surgery and more aggressive chemotherapy for the treatment of the advanced cancer.
So, Jean, what type of precautions are medical facilities taking right now in light of COVID-19 to protect patients?
Well, that's a great question, Liz. I'm glad you asked that. So medical facilities are changing procedures in their sites based on COVID-19. And if you have concerns about what is being done to keep you and their staff as safe as possible in these trying times, just ask. It's okay to call the facility to ask the questions you might have. If you are registered in a facility portal, they also have that information typically on their portal for you to review, as well as their websites where they explain precautions that are being taken. But here are a few questions to consider asking. Are the staff screened daily for COVID-19 symptoms? Are both staff and patients required to wear masks and any other personal protective equipment as needed? Does the screening facility have procedures in place to minimize contact during check-in, waiting, and checkout? Are there a limited number of patients allowed in the waiting area? Are there masks and hand sanitizer available for patients to use in the facility? Are there limitations on who may accompany a patient to their screening? And what procedures for cleaning are in place in the waiting room, procedure rooms, and bathrooms to increase safety for those who are using the areas? It's okay to ask what is being done to keep you and healthcare workers safe in the facility you choose to use for your screening. So now that we talked a lot about screenings and a little bit about cancer and what that's like and how risk factors and things that can contribute to that, I'm going to hand it back to Liz, who's going to talk to you about how Connect Care 3 can help you if you've been diagnosed with cancer or simply want to reduce your risks.
Jean, thank you. That was excellent and timely information. So I hope it's very helpful to people. If you or a covered dependent on your healthcare plan were to receive a cancer diagnosis, Connect Care 3 can assist you. So you would begin by completing our intake with one of our patient advocates, and then you would work with a nurse navigator. And once you're with a nurse navigator, we can research options at centers of excellence for your particular cancer diagnosis, prepare appointment questions for oncology specialists, provide patient education regarding both diagnosis and treatment recommendations, and we can individualize a plan for you based on your particular needs, as well as research and help explain clinical trial information. So we hope that you would consider working with Connect Care 3. We hope you never do have a diagnosis, but if you do, rest assured that we can assist you and be an advocate for you. So next, Jean is going to talk about working with Connect Care 3 to reduce your risks for developing cancer.
Thank you, Liz. So we have our team called our Chronic Disease Management Team. And if you're interested in reducing your risk of cancer, you might want to consider working with one of the members of this team. The team consists of registered nurses, certified health coaches, and a registered dietitian. The team will work with employees to implement and sustain essential dietary and lifestyle changes needed to manage chronic conditions effectively. And those chronic conditions include prediabetes, diabetes, high blood pressure, high cholesterol, and obesity, which you've heard a lot about today. They also have expertise in tobacco cessation. So if you're looking to quit smoking, you can also call and work with one of the members of this team. So we've included resources for everyone here, including the 2 self-exams that we talked about. And lastly, Liz is going to talk to you a little bit briefly about how to connect with the Connect Care 3 team.
Thank you, Jean. So I will conclude our presentation today. We hope you found it helpful. If you would like to work with a member of Connect Care 3 or have any questions about our services, please call 877-223-2350. You can also email us at info@connectcare3.com or go to our website, connectcare3.com. So thank you, and that concludes our presentation today. Have a great day. Thanks.